A warm welcome, dear viewers, today in our health television. Coronary heart diseases. What is the key behind it? To what extent do the sympathetic and parasympathetic nervous systems play a role? Has one really reached a point in life, a boundary, where one perhaps also tries to somehow get out of this dilemma? But to what extent self-regulation, micronutrients and the gut also play a role, you will learn today from our guest. Dr. Thomas Rau and I am very pleased to be able to take the holistic biomedical view of the patient again today. See you soon. Hello, dear Thomas. Nice that you are here with us again today. And the important topic of coronary heart diseases I've been hearing more about lately. And that's why I'm glad that we can also dive a bit into the origin story. To what extent is it all connected with these topics for you now?
Thank you very much for allowing me to speak here. And this is really a topic that is extremely important, extremely many people. We have a lot of patients who come because of coronary heart disease. The patient does not generally know this term. Angina pectoris, or the heart attack, is imminent. So to speak, that is what the patient then brings. Most patients with this condition, these heart complaints, heart cramps or pains, it's not just with excitement. It can also be after a meal, it can be with an excitement and so on.
Mahlzeit sein, es kann bei einer Aufregung sein und so weiter. Also.
Can you say a few more things, symptoms, because there are also such hot flashes and so on. So many don't even recognize it because of various symptoms. You know, there's a bit more to it so that the viewer might recognize themselves if they have an issue.
The coronary heart disease patient, that is when the coronary vessels of the heart are narrowed, this can be due to a spasm, but it can also be due to calcification.
Es kann aber auch durch Verkalkung sein.
If then, in certain circumstances, when the demand is increased, the fine blood supply to the heart muscle is reduced,
Herzmuskels vermindert.
and humans have a very fine sensorium for that.
Feines Sensorium.
They feel it right away and then get a burning sensation or pressure. Those are the classic symptoms.
Klassischen Symptome.
But they can also get vegetative nervous symptoms like sweating, like suddenly that the blood supply in the head is no longer quite right, or that they have a feeling of tightness.
Oder dass ein Engnisgefühl hat.
Not a pain, but a feeling of tightness, as if they are not getting enough breath.
Nicht genügend Atem kriegen würde. Ja.
So the symptomatology is very broad.
Breit.
At some point, they go to the heart specialist and they then look, you know, there are different examinations.
Dann weiß ich, es gibt da verschiedene Untersuchungen. Ja,
You have very tight coronary vessels. We have to. And then usually medication is given first.
Medikamente gegeben.
Patients generally come to us when they already have 3 medications or a combination.
Kombination.
And it's always associated with cholesterol, which is nonsense.
Blödsinn ist.
But anyway, at some point it's like this. They are told, yes, now we need to do a heart catheter examination to see if the coronary vessels are too narrow.
Untersuchung machen, zu schauen, ob nicht die Koronargefäße zu eng sind.
Or they already had that the frequency of heart catheter examinations has increased tenfold since 2000. It is incredible how this examination is practically offered to everyone.
Schon angedient wird.
Then they say, we have a narrowing, we need to place stents. Yes, many people who come to us have already had a stent, or they have been told they need one.
Please excuse the very brief interruption, speaker free, but please be so kind and also subscribe to our channel. It is very important for us since we have been offering Speaker 3 UOL programs for free for 7 years, Speaker 3. We can also gain something if you subscribe to this channel. Please click here and continue to enjoy the program.
Let's come back again. What else can one offer these people?
Noch sonst bieten.
because that's how they come. Naturally, they can treat it differently.
Natürlich das behandeln.
Yes, you can,
Kann man.
but it's a long-term process, and there is an incredible amount of literature and studies on it.
Literatur und Studien.
It works.
Funktioniert.
I can't delve into the studies in this short interview, but with a change of the inner environment, which is a bit of a vague term. What does that mean?
Das ist so ein bisschen wischiwaschi Begriff. Was heißt das?
You can do a lot. When we now look at these patients, can you do something about it? Look at these patients.
Anschauen.
On day one, we're not just testing cholesterol. You've tested that 100 times, usually already on statins that do no good.
Nichts nützen.
And we look at how the autonomic nervous system is functioning, which should dilate the vessels when needed so that more blood gets to the heart and constrict them in rest to conserve.
Weitstellen sollte, dass mehr Blut ins Herz kommt und in Ruhe wieder enger machen, damit gespart werden kann.
So, what is this regulatory system? It depends on the sympathetic and parasympathetic nervous systems.
Sympathikus.
And you can measure that today.
Heute.
The technique of measurement has been so professionalized. Unbelievable. We can tell the patient in 20 minutes what their autonomic nervous system tension state is.
Für ein Spannungszustand im vegetativen Nervensystem.
And heart patients, that is coronary heart patients, those with angina pectoris, heart attack candidates, almost always, I'd say nearly 100%, have an overactivity and overtension of the sympathetic nervous system.
Eine Überspannung des Sympathikus.
If I now, of course, look at the candidates, then I could imagine, I'll take the example of the man, maybe also very business driven, very much under pressure, then starts to train for a marathon, even though he's already completely at his limit in business. Or perhaps also has the classic cases of care, which one may also have in the family circle, that simply push one beyond their limits. How can this aspect also be taken into account? Or do you have opportunities in the clinic to say, we still have to take a look at your life? Yes, we can now, of course, recognize that you are under stress. We can apply regulatory principles on the physical level, but nevertheless, your environment is also an important aspect.
Ja, dein Umfeld.
Not only your environment, but also your perception and your processing of demands.
Und deine Verarbeitung von Anfordernissen.
Stress is not, I have to work a lot. No, stress is, my work burdens me endlessly. My whole life is just a burden. Yes, can't we rethink that? We have a therapist with us. So please, I am a doctor who doesn't psychologize everything. Really not. If someone doesn't do that, then it's me. But we nevertheless have therapists, especially for this diagnosis of sympathetic overload. We have therapists who do this reprogramming in short therapy sessions, so to speak, sessions.
Sessions, also Sitzungen machen.
And it is absolutely striking how you can lower your sympathetic with simple methods, or that it starts to oscillate again, which is what it would need.
Oder dass wieder zu pendeln beginnt, was es eben bräuchte.
That's on one side the sympathetic, on the other side the recovery system, parasympathetic.
Das Erholungssystem Parasympathikus.
Now I would need to sit on a different chair. The Chinese doctor who has tested traditional Chinese medicine on billions of people for 3,000 years. So anyone who still says today that it's just nonsense, that's simply arrogant.
Nur so ein Spinnerei, das ist einfach arrogant.
Western arrogance. Anyone who says something like that? No, that's profound experience.
Erfahrung.
And they say the heart and the small intestine are connected.
hängen zusammen.
They place them in the same energetic system.
System.
Well, the small intestine shapes the parasympathetic system, the recovery.
Erholung.
The diaphragm helps with it. That is Chinese medicine implemented in a European way.
Umgesetzt.
With very simple diaphragmatic breathing, which a person can regularly do, you can bring an incredible amount into this balance. Look at me, I'm really stressed with my professional activity, with my clinics, with my books that I write, with the seminars. How do you do that, doctor? Are you 74? For years, I have practiced a diaphragm breathing technique. I do it after every patient, 30 seconds, 20 seconds.
20 Sekunden.
Regularly, my VNS, my autonomic testing, is fantastic.
Yes, because every time I see you, you are so deeply relaxed.
Yes, but these are such simple techniques.
Techniken
You, dear patients, can easily learn this.
einfachst erlernen.
You can contribute by changing the environment through simple dietary changes.
Einfache Ernährungsumstellungen.
We always talk about a plant-based diet.
Pflanzenbasierte Ernährung.
I am not a vegan preacher, not at all.
Überhaupt nicht.
We do advocate the vegan diet in our center so that people quickly realign, but you don't have to do it completely, but mostly
Nicht voll, aber großteils.
implement it at home. What you do at home, how you think at home, what remedies you take determines whether you have a heart attack or not.
Bestimmt, ob sie Herzinfarkt kriegen oder nicht.
How does a patient feel now who really notices the child is so close to falling into the well? You already have the cold sweats, angina pectoris, this risk or suspicion of it. Can I, through a quick, efficient therapy, if I now say, for example, I really come to you it is indeed a center, but you really have a hotel attached, so that I say, okay, for me, it feels like it's 5 minutes to midnight, that the thing is about to crash. I really come now for a few days and try to get myself into the parasympathetic state as quickly as possible. Because we also talked about neural therapy and such stories, which methods can I quickly implement specifically with you?
I have such a person, a very high up one, in one of the most important car companies.
Autofirmen.
And he's naturally under total stress now because they are systematically being destroyed. The German car companies. Yes, he's got that. He is a great candidate. He knows that. He tries to change his mind as far as possible. And he also exercises because he knows sport is so good.
Weil weiß, Sport ist so gut.
Yes, so to speak. The marathon runner, he does it differently, not with a marathon. Complete nonsense. It only brings more sympathotonic, sympathetic tone. I have to run a marathon now. Exactly the wrong thing. No, the best would be pleasurable. A dog should be involved.
Zugetan werden.
And one takes a pleasurable walk with this dear dog. Walk, don't run.
Also, ich habe das jetzt extra.
Entschleunigen, ja.
Slow down.
Yes, but you can also slow down through simple exercises.
Einfache Übungen.
And that is really easy.
Einfach.
Now another topic.
Thema.
I never sit.
Nie.
For the patient who comes, the coronary heart patients or those who notice, oh, the child is about to fall into the bath.
Ins Bad.
Well, I never say stop with these stupid medications. I never say that. No, they keep taking them. But today we start with the therapy that rebuilds the autonomic nervous system.
Das vegetative Nervensystem aufbaut wieder.
So that regulation can
Beginnen kann.
so that at night they really adjust the coronaries so that they can recover.
Sich erholen können.
and so on. And then after about 6 weeks, you can slowly taper off.
Langsam ausschleichen.
The high blood pressure, if they have it, goes away. It's simple. I did a program about it, but also this tightness
Engnis.
goes away. But it takes a few months.
Einige Monate.
And there are very good studies about it. In New York, a huge study was conducted which showed that a change in physical activity, not exercise in stress, no, physical activity and a change in diet massively reduced the heart attack rate.
Die Herzinfarktrate massivstens gesenkt hat.
Better than stents. A stent is a short-term method and does not change your condition. It may be better for 2 years, but it returns if you change nothing. And this change, I'm not like that. You just have to change. No, they are simple things.
Dinge
Dietary changes make you feel better anyway.
ohnehin besser.
Light physical exercise. We tell you how. And reprogramming the autonomic system. And there are also simple exercises that our therapists can teach the patients.
Den Patienten lernen können. Das ist wirklich.
And then our remedies which improve the oxygen intake at the cell of the heart muscle.
Dass die Sauerstoffaufnahme an der Zelle des Herzmuskels sich verbessert.
Yes, coenzyme Q10. When you take statins, they block coenzyme Q10 and your heart muscle cells can no longer even get enough oxygen, which then actually reaches the heart muscles. You have less oxygen in the heart muscle, so you have to process it better.
Weniger Sauerstoff am Herzmuskel, ja, da müssen Sie den doch besser verarbeiten.
Conventional medical medications do not provide you with this information. However, we can test. There are even blood tests for this on the mitochondrial activity, how much your heart muscle cell still works at all. So the little oxygen that gets there, because you have constriction, is at least being processed there.
Wenigstens dort noch verarbeitet.
Usually not. And that's where we can work. And it works relatively quickly. The patients are inert.
Inert.
Weeks later, they are noticeably less symptomatic because they get more oxygen in the heart muscle.
Kriegen.
In the long term, the change in protein content, the change from acidification to a basicity, in other words, alkaline,
Basizität, also alkalischer.
tuning the body will make a fundamental change within half a year to 2 years.
Eine grundlegende Veränderung machen.
And perhaps a fundamental change in life as well. Why am I in this position where I'm being pushed to the edge? What inner drive do I have to be responsible for everything and everyone and to push myself beyond my limits so much externally?
Meine Grenzen hinaus so im Außen zu belasten.
You know, you also accomplish a lot and your day is full, but you handle it differently. One doesn't get the feeling that you're driven or that you have beliefs like only if you're successful, you will be loved. Those are still inner patterns where we also see in corporate structures that there are quite a lot of deficiencies when it comes to recognition and the whole topic of inner feelings of smallness.
Das ganze Thema angeht, innere Kleinheitsgefühle. Ich brauche die,
Of course, these are also things that certainly need to be regulated parallel to physical regulation.
Regulation.
So I told this auto person in his superposition, I can now address him informally. Great honor, you don't have to give up your job.
Deinen Job nicht abgeben.
No, that's good, you've achieved that.
Erreicht.
You've accomplished so much because you wanted to achieve this. You need this going forward. Now you have so much routine and such incredible skill in what you do. Keep doing it.
Fertigkeit in dem, was du machst. Mach das weiter.
But it has to be viewed differently.
Anders betrachtet werden.
It's really a question of perception and how do I handle it?
Handle ich das?
that works. Yeah.
Great. So it's definitely a super exciting topic, and the nice thing is that with you, all aspects are really covered, so that you can really say, in the end, the person sees themselves as a whole on all levels and comes into self-responsibility and self-regulation. It's really about making sure that the person who comes to you also clearly says, okay, and I say where things are going with my body, so that the patient is also seen at eye level. I think that's also a principle that is very, very important, that you don't leave responsibility at the code check.
The body has an incredible capacity to balance. So not pendling, but to compensate and adjust.
Auszugleichen und zu kompensieren.
And this ability, we can build it up. That's why my patients with coronary heart disease have already had all conventional medical treatments, and it's still not good. With them, you can reactivate this additional bodily function, and over time they don't need the medication anymore because the body does it by itself.
Brauchen sie die Medikamente gar nicht mehr, weil der Körper das selber tut.
That is indeed a longer process which needs to be supported, and where the patient himself, but you have to tell him how can help.
Yeah.
Because the patient actually heals himself in the end.
That is the most beautiful sentence. Also, in addition to all the valuable things you have said, and thank you very, very much, Thomas, for being here again. And I'm, of course, delighted that you help support and really assist the doctors and therapists on the way to treating the human being as a whole. Bringing the new medicine, the biological medicine, into the world.
Yes, thank you very much. So we do many courses about this kind of medicine. If you go to our webpage, you can see that it's for medical personnel of all kinds.
Great, thank you, Thomas, and see you soon.
Und bis bald.
Dear viewers, yes. Very, very important topic, especially with coronary heart diseases, that the person is viewed on all levels, and all the nicer that we have doctors who can convey exactly that to us here.
Genau das uns vermitteln können hier.
And I'm very grateful for that. I hope you enjoyed it too. Thank you for watching. See you soon. Goodbye.
Thank you for watching Swiss Health Television QS24. Please don't forget to subscribe to the channel down here, or watch all our broadcasts ad-free via Wikisana, or consume this selection of broadcasts. I wish you all the best until another time, and goodbye everyone.